The World Health Organization defines health as a complete mental, physical, and social well being, and not merely the absence of disease or infirmity. As all of you may have noticed, there are these stickers all around campus and the Oklahoma City area that say 5320. Many of you may be asking yourselves what this message means, but others might just not care. Well, I'm here today to help you understand this cryptic message. This cryptic message, seen all across the state, known only as 5320, can simply be explained as the number of Oklahoman lives saved each year if Oklahoma simply met national average for health measures. Oklahoma currently ranks 46th nationally for health-related subjects. But with the Shape Your Future campaign, this is all set to change. The Oklahoma Health Improvement Plan, requested by the Oklahoma legislature, not only has a goal set to improve its state's failing health services, but also to educate its inhabitants as well. The 2009 Commonwealth Fund's state score of health system performance ranks Oklahoma 50th in overall health system performance, with the state in the bottom 10th percentile of dimensions of access, quality, avoidable hospital use and costs, equity, and healthy lives. Only on the dimension of avoidable hospital use did the state improve from prior year rankings. The 2009 United Health Foundation America's Health Ranking Report rated Oklahoma 49th both in primary care providers per 100,000 and in the nation overall. Oklahoma was in the bottom 10th percentile for 50% of cited measures. The report also pointed to many challenges the state would be facing, including a high prevalence of smoking, a limited availability of primary care physicians, a high rate of preventable hospitalizations, poor mental and physical health days, a high prevalence of obesity, and a high rate of deaths from cardiovascular disease. Representatives of the state are determined to improve on the state's healthcare systems. A total overhaul is being undertaken to improve the state's failing health services. New programs will be placed in schools to address health education, as well as nurses and healthier menus for breakfast and lunch. The state will also go about expanding its available workforce size of healthcare providers through incentive programs, as well as finding providers willing to accept Medicaid. In addition to these steps, the state has set forth goals to lower tobacco use in the state and to reduce obesity, as well as improve the state's current children's health benchmark. Infrastructure goals have been set to find cheaper ways to finance healthcare services and to increase the availability of care, as well as increase the workforce size, thus increasing the effectiveness of current healthcare practices, another goal set forth by the OHIP. In addition to these steps being taken to counteract obesity, Oklahoma has launched its Get Fit, Eat Smart plan. This plan is to help Oklahoma build state capacity to address the issues surrounding obesity and obesity-related chronic disease across the lifespan and develop a physical activity and nutrition state plan to coordinate and inform future efforts on the topic. The state plan has focused its sights on three specific goals: healthy eating and active lifestyle choices available and accessible in all settings, reduced rates of obesity, and reduced rates of obesity-related chronic disease. The second prong of To Better Oklahoma is an attack on tobacco in the state. Right now, tobacco kills more Oklahomans than alcohol, auto accidents, AIDS, suicides, murders, and illegal drugs combined. Oklahoma Tobacco Control Program has set forth a goal to reduce the prevalence of tobacco to the national average by 2012. For Oklahoma to reach this goal, Oklahoma will need to sustain and expand its efforts in three areas. Oklahoma plans to create an environment aimed to help tobacco users quit for good, as well as provide the resources to quit. The second area is to prevent the youth from becoming addicted, and the third area is to completely get rid of secondhand smoke by creating a smoke-free workplace. With all of these programs being implemented and all of these steps being taken, it seems clear to me that Oklahoma should soon reach its goals set for the future. Oklahoma has also just launched CATCH, or Coordinated Approach to Children Health. This school health program is designed to promote physical activity as well as teach about healthy food choices. and to spread the prevention of tobacco use in children. The CATCH program covers kids from preschool to 8th grade and has been implemented in thousands of schools across the U.S. Though there is no timetable for when all of this is supposed to happen, the state has set its eyes on educating all of its residents on the importance of healthy living. It seems a new day is fast approaching Oklahoma, a day where better health is sought after and a state which can be proud of its healthcare systems.